I chose to study dental hygiene because I had a really good friend of mine that was studying for being a dental hygienist. I really enjoyed the preventive side of the dental hygienist and talking with the patients. I'm specialized with people with special needs like autism, lack of mobility, schizophrenia and so on. Years ago, I am working like the ancient technique, doing ultrasounds all over the mouth, all over the teeth. It can provoke some anxiety for the patient. Even for me, it was painful. We start to have some pains on our hands, some pains on the back, and we had to change something. With GBT, there's a lot at change. That we are doing the instruction of the dental hygiene at the beginning of the appointment. It's more comfortable for me because I'm doing the airflow before the ultrasound, and like that I can remove biofilm and some stains. With the guided biofilm therapy, it's really comfortable for us, it's really comfortable for the patients, and the quality is really nice. The most rewarding part of my job is the trust that I get from my patients. Recently, I treated a kid with autism, 9 years old. It was the first time that he came for the dental hygienist. So we play a little bit, explaining what I'm there for, what I'm gonna do. Then, 1 week later, we started with a second appointment. He was really happy to come. He gave me a high five and everything. He sat on the chair, opened his mouth to start the work. He enjoyed really the airflow. At the end of the appointment, he's really nice. He gave me a hug and said me, "Okay, see you next week."